As part of the support to the Lagos State government and the management and prevention of the spread of COVID-19, the Professional Association of Public Health Nurses of Nigeria, Lagos State Chapter, has donated some medical consumables, which include 2,000 pieces of lattice hand gloves, 2 cartons of hand sanitizers, 1,000 pieces of cloth nose mask for the public and not for clinical use, and 7 cartons of hypo bleach. These items were delivered on Wednesday, the 20th of May 2020 to the Lagos State Ministry of Health in Alausa, Ikeja, and they were received by the Director of Nursing Services, Nurse Dorcas Shonibare, Mrs. Tunwase Adebowale, representing the Permanent Secretary, and the Director of Pharmaceutical Services, Dr. Moyosore Adejumo, on behalf of the Commissioner for Health. The association used the opportunity to discuss some challenges they face as public health nurses and further appealed to the state government to help fill the vacuum left by retired public health nurses by recruiting public health nurse specialists, create a conducive working environment, as well as train more public health nurses in the state to ensure health care delivery to the community.
So thank you very much. I know it pains you so much that public health nursing is going down the drain, but it will not. It will not. But it calls for collaboration and support of everybody. So lastly, before I end it, this uniform of public health nursing. It's how you put it on. Wow. I feel like going to the school.
We just give you some waivers.
Public health nurse. Thank you very much once again.
Thank you so much.
The items were presented to the ministry in front of the Ministry of Health building to give room for more social distance.
So our association is making this donation in support of the state government for their efforts on COVID-19 response. Here we have 1,000 pieces of cloth face mask, which is meant for the community. It's not meant for use in the clinical areas. Then we have 7 cartons of hypo. In each carton you have 12 bottles of 1 liter each. We have 7 cartons. We also have latex hand gloves, 2,000 pieces, and also sanitizers, 144 pieces.
The National Association of Public Health Nurses in Nigeria, they are making donation of these items today to support the response of the state government to the management of COVID-19 in Lagos State. And the essence of this is to ensure that nurses are fully protected as they care for the common man in Lagos State. You know, any sick person is entitled to enter any of our hospitals, even during this period. But how do you know who is having COVID? It's not written on their faces. So that is why our health workers must be protected.
So we want them to ensure they have their correct personal protective equipment properly adorned, and when they are removing it, to ensure that they remove them the way they are taught so that they do not infect themselves. And of course, psychologically and mentally, they should have it at the back of their mind that they are rendering service to humanity and they are not looking forward to losing their lives as a result of this activity.
We believe that our governor, Mr. Babajide Olushola Aduragbemi Sanwo-Olu, has been doing so much and tremendously well in Lagos State. He is an action-packed governor, and we believe that as a professional association of public health nurses in Nigeria, we also need to support our government. We need to support our governor for eradication of COVID-19 in Lagos State.
The year 2020 has been declared by WHO as the year of the nurses and the midwives. And that is in remembrance of Florence Nightingale, who ought to clock 200 years of age if she's still alive. And she came to limelight during the Crimean War. And to remember her 200 years, another pandemic is here. So nurses are the frontline health worker in any pandemic. Other professionals who only come, attend to the patient and go. But it is the nurses that stays with the patient, whether infected or not, for 24 hours every day. 24/7. Nurses are always there. Nurses must protect themselves. Because it's only when you are protected that you can protect any other person. Okay? Like some will say, there is no emergency in pandemic. Because you must save yourself in order to be able to save everybody. You can imagine if I have only 30 nurses and 25 are exposed to this COVID-19. I cannot produce nurses within few hours to take care of the remaining patients. So that is the importance of nurses protecting themselves so that they will be able to save others as well.
Following the donation of the consumables, the association demonstrated effective use of hand sanitizer and recommended ways to wash hands towards ensuring disease prevention and spread.
Wet the hand, then. So you have to wash hands for at least 20 seconds. You sing any song of your choice. You don't have water and soap, and you need to keep your hands clean. You don't want it to be an excuse that there is no soap and water, and so you're not keeping your hand clean. And that is where you are talking of using of hand sanitizer. And the way we use the sanitizer matters a lot. Everybody needs to know how to use it, not the way most of us are using it. The sanitizer is just like you are using water and soap. You rub it on your hand. You go to the back of your hand. You interlock. You wash your thumb, the tip of your fingernail, the tip of your finger. Wash your knuckle up to your wrist. These are all the places where the virus can hide. So this is how we use it, that we make it to be effective, not using it under 1 second. Doing this, we get rid of the virus. And we have said it should be an alcohol-based sanitizer with minimum of 70% alcohol. So if you are using hand sanitizer, ensure that you look at the right top. Does it have up to 70% alcohol? Having done that, you are sure that your hand is clean for that period. Doesn't mean you will not use it again throughout the day. As long as there is no soap and water for you to use, continue to use your hand sanitizer. Thank you very much.
The consumables donated were taken to Lagos State Medical Warehouse and Lekki Phase 1, and they were received and documented by the representatives of the Lagos State at the warehouse.
On behalf of Professional Association of Public Health Nurses of Nigeria, Lagos State Chapter, we are making this donation to Lagos State Government in support of their efforts towards the management of COVID-19 in the state. We are making this donation because we belong to the specialist group of public health, and COVID-19 is a public health crisis. Though all our members are on the field doing what they know how to do best, that is prevention and control of disease, taking care of the individual, families and communities from cradle to the grave. And we just feel that by adding this donation, it just shows the level of our involvement to ensure that this COVID-19 is curbed. And we also belong to a larger group of the Society for Public Health Professionals in Nigeria. Though our primary domain is the Nigerian Nurses Association of Midwives, Nurses and Midwives of Nigeria. But because we are specialists, we also belong to that Society for Public Health Professionals of Nigeria. And this group also belongs to the Africa Federation of Public Health Professionals, also an affiliate of the World Federation of Public Health Professionals. So it dawned on us that since we belong to these bodies, we have to show our involvement and how keen we are to ensure that this COVID-19 is curbed, the transmission is curbed in the state.
On behalf of Lagos State, we want to appreciate you, ma'am. We want to appreciate your support. We all know that this COVID-19 is not for government alone. It's for everybody that have the capacity to do one thing or the other. The fact that you are part of the people, you are the major key player, and you also come to support us in terms of consumable. We really appreciate. Thank you, ma. God bless you.
This is part of their support in prevention of the spread of COVID-19 in Lagos State. My name is Adejumo from Nurses and Midwives.